Today we're speaking with Chris Panebianco, Chief Marketing Officer of Bankers Healthcare Group. As dental practices start to reopen and recover from the pandemic, they're going to need the finances to do so. And Chris today will discuss some of the options that dentists have. So first of all, Chris, generally speaking, what has the shutdown's impact been on dental practices?
Well, we've seen it. It's been very impactful, Rich. No revenues coming in. About 97% of practices were forced to shut down outside of emergency procedures and pretty much lay off their entire staff. So those without cash reserves on hand, it hurt the most. Not only are they trying to cover their immediate costs, but they're ill-prepared to reopen. As you know, with the CDC guidelines, dentists have had to change their practice. And, it's been a huge impact. And we're talking to our customers every day. We've surveyed them. We're taking inbound calls. We're reaching out to them actually to be proactive, to better understand how BHG can help them and really being sympathetic to what they're going through. So we've heard a lot. It's been nationwide. We've worked with tens of thousands of dentists over the last 19 years. And, they're coming back to us looking for help as they do come out. As of the first week of May, I believe about 50% of practices have hired back their staff. So, now they're just facing unexpected costs of PPE, changing their practice around, the patients that'll be coming in. So we've seen a huge impact.
Okay, and what do you think some of those most important costs are right now? PPE, of course, is in such short supply across the country, but it's not just masks and gloves. Equipment and other things are going to be essential as well. What are some of those big ticket items that dentists will need to cover?
Well, definitely. I think one of the areas that they're looking at now are even the aerosols that come off of every procedure. As people are having their teeth cleaned, you need to get the proper ventilation systems. We've got a great partner in Healthway. They're working with the entire industry, but those costs can be anywhere from $3,000 to $5,000 a piece. In addition, they're having to spread out their practices and move chairs, put up plastic separators. So it's not just the PPE, it's the actual physical movement and necessities within the practice that they're having to do, as well as overhead. They're still having to pay the bills, electricity, cable. None of their debt stops because they've been out of practice. So, mortgage payments, equipment, technology, these are what our customers are telling us every day and why they're coming back to us. I've personally talked to 30 or 40 dentists and heard the same thing over and over.
Okay, so these are pretty common concerns that you're finding out there in the profession.
Yeah, and we're hearing it from our customers directly. And I read a great article on CNBC. I believe it was Bertha Coombs. She wrote a great article about the comeback, the percentages of people that were laid off, and then what they're doing now to prepare their practice as things have changed.
So even though a lot of states are saying, hey, we've lifted the restrictions, you can go back to routine and non-elective procedures, do you see dental practices just jumping back in the pool with both feet, or are they taking their time and getting ready again?
From what we've heard from our customers, they're going right back. From personal experience, my dentist, I had a procedure scheduled for 2 weeks ago, and they pushed that out to September, not because they don't want to do it, but because they've had to change their practice so much. They've had to spread appointments out, but they've got full staff. A lot of our customers said their staff's back on. A lot of dentists have used the PPP program, the payroll protection from the government. But that, again, is not going to get them 90 days, 180 days out from where we are today. We fully believe, it's your mouth. Patients, I'm starting to feel something right now in one of my teeth, so I know I've got to get back into the dentist. So at BHG, we fully support our dentists, and we know that they're going to get back. People are going to come in. I think it's just a new way of thinking about things and a new way of practice that dentists are going to have and their staffs are going to have to adjust to, including their patients.
Okay, and of course, in the news, there's been a lot of publicity about the stimulus package, the PPP program, the emergency disaster loans. Can you provide a little bit more detail about some of those programs?
Sure. The government came out, and they came out very quickly with the first round of PPP. I think that, as anyone knows who's been in finance, is not easy, especially when you're dealing with a pandemic on top of that. So that grew, that initial group of money went very fast. Those funds were quick. We've participated. We have a wholly owned subsidiary called Fundex Solutions Group, which offers 7A loans. We're one of 14 non-bank lenders in the country. So we had a very unique firsthand look at PPP. We did over 1,200 loans for about $175 million, and it really affected about 17,000 jobs. So we saw firsthand the gratitude of the small business owner, the dental practitioner, our physicians coming in, and this was a lifeline. It saved practices, it saved jobs. So we've seen that. Now I think what you're going to see, there's still money left in the second round. It's something that Fundex we're currently working with hundreds of applicants right now to get them into that while the money's still there. There may be a third round coming, but we feel very confident within our ability to lend on the working capital side or personal loan side through BHG, but also on the 7A side, there's some great programs that we have access to that are both government and private equity that can really help a dental practitioner out.
Okay, so if you are a dental practitioner and you're struggling to meet some of those expenses and provide those finances, what would the first step be? Where should they go first?
I think number one, they have to prioritize. They have to see what's most important. So what do I need financing for? Do I have a lot of unexpected expenses? Am I trying to keep the lights on? Is it the equipment? Is it the PPE? There's a lot, but you have to prioritize it. What's going to get you back into that chair and get patients into your chair so you can start to earn that revenue off of these procedures. So my best bet would be to prioritize, get your finances in order, consolidate multiple debtors out there or debt liabilities, and then find a partner that you can trust, someone that's there in good times and bad. We've seen it all over the finance industry. Lenders are pulling back or they're tightening restrictions. And you know, we have a very unique look at this because we've been around since 2001 and worked with healthcare professionals and dental professionals. So we've seen 9/11 happen. We've seen the Great Recession in 2008 to 2011. So we have a very unique perspective. But you know, find a partner, prioritize, and really get your book in order.
Okay. Are there any other best practices you would suggest for dental practices that are looking to get back on their feet right now?
Yeah, I think right now it's really, you know, as I said, find that partner that can educate you on what's available. It may seem a little overwhelming, but we're definitely willing to help you out, walk you through and educate you on what's available. But most of all, you know, figure out what it's going to take to get your business going and keep it solidified. We have no idea what the future holds, but dentistry is a strong profession and it's something that's necessary and essential to our society. So I fully believe that, you know, we will bounce back, and it's just a matter of time and hard work.
Okay. And again, there are just so many pressures out there, so many options out there. Where can dentists go for more information about some of these programs?
Definitely. You can feel free to contact me directly. My email is chrisp@bhg-inc.com. Feel free to visit us on bankershealthcaregroup.com or fundexsolutions.com.
Okay. Do you have any other programs that might provide information for dentists that are looking to learn more?
Sure. We also have a collections company that we found some great leverage within the dental community to look at what they're owed, the money they've already earned. It's an area that we're very fond of. Collections can be a scary thing, but we've got some great resources through Capital Collection Management. That's our collections company, and they'd be willing to help any practice with some advice or to do collections for them with a no-risk guarantee.
Okay, great. And if any of our readers have any further questions, they'll, I'm sure, reach out to you and the resources you've been able to provide. Thank you so much for taking your time today.
My pleasure. Thank you so much, Rich.
Great. Have a great day.
Thank you.